and good day. My name is Jürgen Steinmetz from eTurboNews, and this is a breaking news update. For more news updates and shows, please go to youtube.com/travel news group. youtube.com/travel news group. Here's our update.
New research, COVID-19 vaccine booster shots 90% effective against Omicron. Americans should get boosters if at least 5 months have passed since they completed their Pfizer or Moderna series, but millions who are eligible have not gotten them. 3 new studies by the U.S. Centers for Disease Control and Prevention (CDC) reveal that Pfizer-BioNTech and Moderna booster shots were 90% effective at keeping people out of hospital after they had contracted the Omicron variant of the COVID-19 virus. The booster doses have proven highly effective at preventing Omicron-related hospitalizations, according to CDC. Booster jabs were also 82% effective at preventing emergency department and urgent care visits, research data indicated. The research comprised the first large U.S. studies to look at vaccine protection against Omicron, health officials said. Americans should get boosters if at least 5 months have passed since they completed their Pfizer or Moderna series, but millions who are eligible have not gotten them, the CDC's Emma Accorsi, one of the study's authors said. The papers echo previous research, including studies in Germany, South Africa and the United Kingdom, indicating available vaccines are less effective against Omicron than earlier versions of the coronavirus, but also that booster doses reverend up virus-fighting antibodies to increase the chance of avoiding symptomatic infection. The first study looked at hospitalizations and emergency room and urgent care center visits in 10 states, from August to this month. It found vaccine effectiveness was best after 3 doses of the Pfizer or Moderna vaccines in preventing COVID-19 associated emergency department and urgent care visits. Protection dropped from 94% during the Delta wave to 82% during the Omicron wave. Protection from just 2 doses was lower, especially if 6 months had passed since the second dose. Officials have stressed the goal of preventing not just infection but severe disease. The second study focused on COVID-19 case and death rates in 25 states from the beginning of April through the end of December. People who were boosted had the highest protection against coronavirus infection, both during the time Delta was dominant and also when Omicron was taking over. Those 2 articles were published online by the Centers for Disease Control and Prevention. The Journal of the American Medical Association published the third study, also led by CDC researchers. It looked at people who tested positive for COVID-19 from December 10 to January 1 at more than 4,600 testing sites across the U.S. 3 shots of the Pfizer and Moderna vaccines were about 67% effective against Omicron-related symptomatic disease compared with unvaccinated people. 2 doses, however, offered no significant protection against Omicron when measured several months after completion of the original series, researchers found. If you are eligible for a booster and you haven't gotten it, you are not up to date and you need to get your booster, CDC Director Dr. Rochelle Walensky said during a White House briefing on Friday.
Thank you for listening to our news update. There's more on youtube.com/travel news group, or you can read us, of course, in going to our news portal at eTurboNews.com or travelnews.online.